Alright guys, I'm going to talk to you about an injury with the transverse abdominis muscle. So the transverse abdominis can be injured by a direct blow to the abdomen or by a sudden repetitive trunk movement, either rotation, flexion, extension. So a sudden twist or rotation of the trunk can cause a tear or strain. And this injury can be avoided by performing strength training exercise like the one that we just demonstrated for you. So like your planks, your crunches, any kind of core stabilizers will help prevent injuries. And then treatment methods include rehabilitation, so physical therapy. You're going to want to do a lot of deep breathing exercise to get that core muscle working again, and then you're also going to want to do some recruitment training.
So to stretch your transverse abdominis, you want to do a trunk flexion, and you can do that by putting your hips to the ground and lifting yourself up with your arms and pulling your head back and really stretch your abdominal area.
So this exercise is working the transverse abdominis muscle. The origin of the transverse abdominis is the inner surface of the 7th through 12th cartilages of the ribs, the deep layer of the thoracolumnar fascia, the anterior 2/3 of the iliac crest, and the lateral 1/3 of the inguinal ligament. The insertion point is the linea alba, the pubic crest, and the pubis. The action is the rotation, flexion, and lateral flexion of the trunk. The transverse abdominis muscle is innervated by the lower intercostal nerves.
Okay.
This is a side plank. The primary muscles in this are the rectus abdominis and the transverse abdominis, and then the internal and external obliques are also involved. The rectus abdominis originated on the pubic symphysis and inserted on the xiphoid process and the costal cartilages 5, 6, and 7. The transverse abdominis originates on the costal cartilages of 7 through 12, the thoracocolumnar anteprosis, the iliac crest, and the inguinal ligament. And it's inserted on the abdominal anteprosis of the linea alba.
Alright, to stretch the internal abdominal oblique muscle, you're going to do a lateral extension of your trunk on either side. So just like this. And then on the other side, get a nice extension.
The origin of the internal abdominal oblique muscle is the deep layer of the thoracolumbar fascia, the anterior 2/3 of the iliac crest, the lateral 2/3 of the inguinal ligament, and the iliopsoas fascia. The insertion is the lower margins of the 9th through 12th ribs, the pubic crest, the anterior and posterior layers of the linea alba as well. The action is rotation and lateral flexion of the trunk ipsilaterally, compressor of the abdomen, antagonist to the diaphragm, and the innervation are the lower intercostal nerves.
Hey guys, gonna talk to you guys about an injury including the erector spinae muscles. So that's your spinalis, longissimus, and iliocostalis muscles. And these injuries to the erector spinae muscles can occur during daily activities like sports, gardening, household activities, or in extreme cases, injuries can occur like in car accidents, in more extreme cases like that. So the common injuries for these muscles include sprains and strains, and then some more serious injuries can include a herniated disc, or a fractured vertebrae in the back. So treatment methods for these injuries can vary just depending on the severity of the injury. So it can include rest and icing, anything from rest, ice, to physical therapy, to surgery. So those are all treatment methods. And these injuries can be prevented by maintaining a healthy weight, lifting objects with your legs, and using your lower back for support. As we talked about in class, you're going to want to use a combination of those body areas.
Stretch your iliocostalis muscle. What you want to do is put both of your arms over your top of your head and flex your trunk from side to side and really feel the stretch in those back muscles. And then
Right. This exercise is working the iliocostalis muscle. The origin of the iliocostalis is the sacrum and the iliac crest. The insertion points include transverse process of the upper lumbar vertebrae, the 6th to 12th ribs, the thoracolumnar fascia, and the upper angle of the 1st through 6th ribs. The action of this exercise, or this muscle, includes extension, abduction, and rotation of the spine. The innervation comes from the dorsal branches of the thoracic nerves, L1 nerve, L2 nerve, and L3 nerve.
To stretch your longissimus muscle in your back in the erector spinae group, you're going to do trunk rotation, medial flexion, and extension, and just feel it.
This exercise is working the longissimus muscle, which is one of the erector spinae muscles. The longissimus is originated at the sacrum, the iliac crest, the spinous process of the lumbar vertebrae, and the transverse process of the lower thoracic vertebrae. The insertion points include the 2nd to 12th ribs, the costal processes of the lumbar vertebrae, and the transverse processes of the thoracic vertebrae. The action includes extension and lateral flexion of the trunk, which is what Justin is showing us right now, and the innervation includes the dorsal branches of the thoracic nerves.
During lower body exercises and even less simple things like running, there's some common injuries that can occur. One common injury is called an IT band syndrome. IT band syndrome is a common painful condition where the connective tissue and then the leg, well, the IT band, rubs against the thigh bone during knee flexion and extension. Treatments can include anti-inflammatory drugs, or you can rest, ice, compression, and elevate your leg to help the swelling go down. Another lower body injury that is pretty common that can occur is something called piriformis syndrome. Piriformis syndrome is when the piriform muscle in the buttock irritates the sciatic nerve. So symptoms include pain, tingling, and numbness in the butt and down the back of the leg. Treatments include anti-inflammatory drugs. You can do stretch or go to physical therapy, or massages sometimes help too. During lower body exercises, one very common syndrome is patellofemoral pain syndrome. This is the most common cause of knee pain seen by doctors today. It's common in people who play sports, especially in women and younger adults. The most common symptom of this syndrome is just knee pain, and it increases with stair climbing or squatting movements. The primary treatment is rest, but pain relievers can be taken too, and physical therapy can also reduce some pain.
In order to stretch the vastus lateralis, I'm going to put this front foot forward, and then I'm going to flex my back leg, the knee joint. And this is the leg that I'm stretching. You're going to get that stretch in the back leg.
Okay. The origin of the vastus lateralis is the greater trochanter of the femur, the lateral lip of the linea aspera, and the gluteal tuberosity. The insertion point is the tibial tuberosity via the patellar ligament. The action is extension of the knee joint, and the innervation is the femoral nerve from L2 to L4.
To stretch your
Gracilis.
Okay, don't restart it.
Okay.
To stretch your gracilis, what you want to do is get in a butterfly position and do external rotation and abduction of your hip joint. This exercise is working the gracilis muscle. is originated at the pubic symphysis and the inferior pubic ramus. It is inserted at the medial surface of the tibia. The action includes adduction and flexion of the hip joint, flexion and internal rotation of the knee joint. And the nerve supply, it is innervated by the obturator nerve, which is L2 through L3. Hi guys, so I'm going to talk about an injury for the rectus femoris muscle. A tear or strain can occur through forcible eccentric contraction of the muscle. So this can happen when, this can occur by starting a sudden sprint or forcefully kicking a ball, especially if there is another opponent coming at you and you're kicking it and a little contraction there. A treatment for this injury is usually non-operative, so it doesn't usually call for surgery. Usually calls for rest and ice to the affected area, which can be super helpful. And then to avoid this injury, you're gonna work on strengthening your rectus femoris muscle, and then avoiding like any kind of direct contraction or contact that could potentially strain the muscle. And then also in the treatment method, you're gonna want to avoid direct physical activity. To stretch the rectus femoris muscle, you're going to flex the knee joint and you're going to extend the hip joint like this. Lateral view.
The origin of the rectus femoris is the anterior inferior iliac spine and the superior part of the acetabulum. The insertion is the tibial tuberosity and the patella. The action is flexion of the hip joint and extension of the knee joint. And the innervation is the femoral nerve from L2 to L4.
Right. In order to stretch the gluteus medius, you're going to flex. So you're gonna like make a flexion in between your your quads and your trunk, just to get a good nice and stretch in that gluteus medius area.
The origin of the gluteus medius is the external surface of the ilium between the anterior and posterior gluteal lines. The insertion point is the lateral surface of the greater trochanter of the femur. The action is abduction of the hip and stabilization of the pelvis, and flexion and internal rotation for the anterior part, and for the posterior part is extension and external rotation. And the innervation is the superior gluteal nerves from L4 to S1.
This is hip abduction. The glute medius is the major muscle in this lift. The glute medius originates the external surface of the ilium and inserts on the lateral surface of the greater trochanter of the femur. This is in the frontal plane and they're doing hip abduction. Another muscle in this lift is the tensor fasciae latae. The TFL originates on the anterior superior iliac spine and anterior part of the iliac crest. It's inserted on the iliotibial tract, and this is innervated by the superior gluteal nerve, L4 through S1. These are calf raises. The gastrocnemius is the main muscle in this lift. The origin is on the femur and the medial femoral condyle superiorly. It's inserted on the dorsum of the calcaneus via the calcaneal tendon. This is plantar flexion. The fibular longus is also a muscle in this lift. It's originated on the proximal 2/3 of the fibula. It's inserted on the calcaneiform of the base of the metatarsal.